Hi, I'm Ben Nowell. I'm with the Global Healthy Living Foundation, the Creaky Joints patient community, and I'm here at EULAR 2018, and I'd like to tell you about a study that we did, and we had a poster presented this year in Amsterdam. The study was on RA patients and the barriers to treatment optimization. So this was a study where we surveyed 249 patients within our ArthritisPower patient-powered research network, essentially a patient registry. And we have information about these patients, for example, their patient-reported outcome data, the RAPID-3, several of the NIH PROMISE measures. This study in particular was a cross-sectional study that we did where we asked some specific questions to try to understand sort of barriers to changing treatments, to treatment optimization that were faced by patients, and also patients' perception of their own disease activity. So some of the things that we found were that of the proportion of the patients who were in high disease activity as defined by the RAPID-3, we found that 2/3 of those patients were actually not offered a treatment change. Among the patients who were offered a treatment change and decided to make a treatment change, it was because that their RA symptoms had not gotten better or were actually getting worse on the current treatment. That was the number one reason. The second reason for that group of patients was that, for more than half of them, was that their doctor recommended making a change in treatment. What's interesting is that we also asked and examined for patients who decided to scale back their treatment. The number one reason they decided to scale back was also a doctor's suggestion. They said their rheumatologist had recommended it. And similarly for patients who decided to stay with the treatment they had, even if the patient was in high disease activity, they were again deferring to their doctor, and it was because their doctor said that it was okay to stay with their current treatment regimen. We also wanted to examine in this study how patients' sort of subjective self-report of their disease activity, just with a one-item measure over the past 10 days, or the past 7 days. How would you rate your disease activity, low, medium, or high? We found that there was actually very weak correlation between that sort of one-item measure, patient self-report, subjective expression of their disease activity, with their RAPID-3 scores. So what we're finding is that a couple kind of conclusions we're drawing from this is that it seems that patients are still very deferential to their doctor's recommendations, that it might help to find ways of activating or educating patients to understand when they are in high disease activity and when it might be appropriate to talk about a treatment change with their doctor. And then finally, that perhaps the RAPID-3 may not be the most relevant for at least the patients in this survey and this sample to reflect how they perceived or experienced what they understood to be for themselves high disease activity.